Okay, well, I want to welcome our audience today to this webinar entitled How Affordable Childcare in Rural America Can Unlock Our Economic Potential. My name is Linda Smith, and I am the director of the Early Childhood Initiative here at the Bipartisan Policy Center in Washington, D.C. And for those of you who know us or don't know us, we are a bipartisan a think tank that tries to take the best ideas from both sides of the aisle to promote policies that address our nation's most pressing problems. And obviously, childcare is one of those pressing problems for our country today. Every region in the country has rural areas. In the majority of states, a quarter to a half of the population live in a rural area. With a smaller and aging workforce, rural regions need to recruit younger workers and families, and childcare is a must. So what we're going to talk about today is the gaps in this and how we can begin to address those. As a percentage of the issue, gaps in the supply and the resulting economic impact of those gaps are larger in rural parts of our country. There are economic implications to households, businesses, and tax revenues as a result of that. To learn more about the unique challenges parents face in rural America, BPC surveyed rural parents back in 2021. We found that 86% of rural parents who are not working themselves or their partner is not working say that childcare is a major influence on their decision not to work, 86%. Childcare is essential to the survival and the growth of rural communities. To address the challenges and solutions, we worked on a new rural childcare policy framework that you're seeing today. This framework was developed in partnership with our friends at Save the Children and several organizations and individuals who participated in our Childcare in Rural America Roundtable earlier this year. Today, we will talk about the new framework, including several solutions and policy recommendations to build supply and develop the workforce and facilities. Then we'll be joined by our panelists who are on the ground working to build childcare in rural areas. But first, I want to introduce our partner on today's webinar, Save the Children. Mary Nugent is a member of the Save the Children Policy, Advocacy, and Campaigns Division, where she leads the early childhood education portfolio for the domestic policy team. I'm going to let her talk a little bit about Save the Children's interest in this and what they are doing, as well as the partnership that we have with them. So Mary, I'm going to ask you to say a few words.
Great. Thanks, Linda. And thank you, Linda and the Bipartisan Policy Center, for your leadership and partnership on this really crucial issue. Save the Children's work on rural childcare is born out of both our long-standing programmatic work on early childhood in rural education and our commitment to advocacy on early childhood, the issue that our campaign arm, Save the Children Action Network, was founded upon. Save the Children works exclusively in the most rural communities across the United States and has done since our beginning in the 1930s, serving hot meals to children in Appalachia. In 2022, we served over 3 million meals to children, cared for around 4 million children in emergency response and recovery situations, and invested in kindergarten readiness across the US. Our Head Start program served around 2,000 rural children in communities in Arkansas, Louisiana, and North Carolina. And we run a program in part using Department of Labor grants to provide pathways to achieving CDAs, associate's and bachelor's degrees for aspiring early educators in rural communities across 6 states. 20% of the national population live in rural communities, and this includes 13 million children. And as Linda said, we know that childcare is an issue at the forefront of minds of rural Americans. Save the Children Action Network did a poll in November 2022, and we found that nearly 4 in 10 rural voters reported having to leave the workforce due to a lack of affordable childcare, and 70% said that access to high quality and affordable childcare would strengthen the economy and help workers. So with our policy work, we hope to raise up the rural context to lawmakers considering the bigger early childhood education picture, as well as to include childcare as part of the conversation about rural economies. BPC's rural childcare policy framework is a really important step in these efforts, helping to frame the unique challenges and opportunities for childcare providers, families, and economies. we're really excited to be able to partner and to work together, and we're excited to hear from the panelists today. So thanks, Linda and BPC, for everything you're doing.
Okay, and thank you, Mary, so much for your partnership. It's been ongoing for quite some time, and it's very important to this work. I want to remind attendees in the audience that we will be taking questions after the presentation in the panel. So if you want to submit questions, you can submit them on the live chat on YouTube or on Twitter using hashtag BPC Live. And if we don't get to your questions, just a reminder that we do follow up after the webinar and will provide answers to the questions of those who were signed on to the webinar. So I'm going to first introduce our first presenter, Brittany Walsh. Brittany is the Associate Director here at the Bipartisan Policy Center Early Childhood Initiative team. And I want to, as well as call out Brittany on this for her work, mention two other staff people who worked very hard on this issue, Catherine Mercado and Tara Williams, who have worked alongside Brittany and myself on this framework. So Brittany, why don't you give an overview, and then we'll turn to our panelists.
Sure. Thank you, Linda, and thank you to Mary and Save the Children for their wonderful partnership and contributions to this project. As Linda mentioned, my name is Brittany Walsh, and I'm an Associate Director for the Early Childhood Initiative at BPC. And I want to thank everyone who has joined us. Today, I'm going to explain the rationale behind BPC's work in this space, as well as our approach to developing the Rural Child Care Framework document. I will cover the major barriers to access faced by rural communities, as well as highlight innovative solutions gleaned from our roundtable discussion held earlier this year, as well as discuss policy recommendations for businesses, nonprofits, local, county, and municipal government entities, and state and federal policy leaders. Before jumping into the framework itself, though, I want to express our gratitude at BPC for the individuals who joined us at the Rural Roundtable, sharing their experiences and expertise to inform the findings and recommendations included within the framework document. Voices from partners across the early childhood field, tribal and migrant worker communities, farming communities, manufacturing, institutions of higher education, federal agencies, Capitol Hill, financial intermediaries, and businesses are reflected in the framework, which would not have been possible without them. In 2020, BPC sought to answer the question of how much additional childcare is required to meet the national need. In other words, what is the childcare gap? A childcare gap occurs when the number of potential children in need of childcare exceeds capacity. But BPC also wanted to understand how much does that gap cost communities in terms of economic impact. We know through a series of BPC parent survey findings that the lack of access to childcare imposes a number of constraints on parents' ability to work. For example, 66% of parents said finding childcare impacts the number of hours they can work, whereas 50% said it affects whether they can search for a job, and 68% said it impacts whether they can stay in the workforce. The economic implications of parents unable to enter the workforce extends to households, businesses, and even state and federal tax revenues. Gaps in childcare supply and the economic impact of those gaps are larger in rural America than in urban areas. The nationwide childcare gap in urban areas is 28.9% versus 35.1% in rural communities. Nationally, the gap is estimated to be approximately 31.2%. States with the largest rural childcare gaps face the greatest economic consequences, with costs in the rural areas studied by BPC ranging from $33 billion to $50 billion. The research conducted by both BPC and its partners, what we know about rural childcare is that 33 children are seriously injured every day in an agriculture-related incident, and the workforce, both in childcare and in other industries, is aging out. 97% of farm families surveyed report safety for their children is a major concern, with 62% reporting access to affordable care is an important strategy for keeping their children safe. 86% of families report they or their partner are not working due to the lack of childcare, with most reporting that they cannot afford more than $200 to pay for care. As mentioned previously, gaps in childcare supply and the economic impact of those gaps are larger in rural America than in urban areas. Rural residents travel longer distances to access services and resources than in cities and suburbs, affecting families' access to childcare programs and parents' ability to remain in the workforce. Moreover, the rural childcare workforce has less access to resources, including professional development and higher education. Rural areas feel childcare workforce shortages more acutely than their urban counterparts, making it even harder to sustain programs and maintain quality. Rural challenges are felt by every stakeholder in the childcare system, from families of young children to businesses to state administrators. For example, geographically large states with small populations have additional administrative burdens because of added travel. For agency staff, it costs more to perform licensing inspections, provide coaching and technical assistance, perform observations, and implement professional development trainings. Just a snapshot here, more than 40% of the population lives in rural areas in the following states: Vermont, Maine, West Virginia, Mississippi, Montana, Arkansas, Alabama, New Hampshire, Kentucky, and South Dakota. More than 2 million people live in rural areas in each of the following 11 states: Texas, North Carolina, Pennsylvania, Ohio, Georgia, Michigan, New York, Tennessee, California, Alabama, and Virginia. As you can see on this slide, while there's a 6+% greater gap across rural communities than urban, the gap could be much greater. For example, across West Virginia, Montana, and Alaska, the rural childcare gap is 39.5%, 56.8%, and 69.9% respectively. And in each of these three states, the rural gap is greater than the statewide gap averages, meaning even across rural America, there is a disparity in access to care. Additionally, many rural counties have high and persistent levels of poverty. Where poverty is highest, families struggle the most to afford childcare for their children. Of parents surveyed in rural areas who considered a licensed program, but instead relied on parent or relative provided care, more than half said that cost influenced their decision not to use that childcare program. Operators of childcare programs also face affordability challenges. Directors need funding to open their programs and to withstand enrollment fluctuations. They also need adequate revenue to maintain facilities and equipment. Private capital investors and existing childcare business owners are less likely to expand in rural areas where small populations and limited resources add additional challenges. Federal, state, and local funds are less accessible in rural areas as well, which often lack coordinated regional services. As a result, childcare programs struggle to access financing. However, while rural communities lack economies of scale, it does not mean that childcare in rural or remote communities is impossible. It does mean we have to recognize that the cost to provide that care, however, will be greater. To address the childcare gap, childcare supply must also be addressed to accommodate the need. To increase access to childcare and early learning, states and communities can support the construction, renovation, and maintenance of facilities in ways that are responsive to rural contexts. This support could include partnerships with employers, school districts, and other local community partners. I'd like to share a few examples of state initiatives that we featured in a 2023 update to our report titled From the Ground Up, Improving Childcare and Early Learning Facilities. For example, in 2019, Arkansas's governor signed Act 131 into law, which encouraged childcare facility entrepreneurship throughout the state. The initiative provides new childcare programs with information regarding licensing and financial supports. From 1997 to 2020, California had its childcare facilities revolving loan fund, which provided funding to eligible childcare programs for the renovation and or repair of existing facilities to make the building suitable for childcare service licensure. And in 2021, the California legislature passed the Child Care Development Infrastructure Grant Program, a $350.5 million investment in the childcare infrastructure across the state. In 2020, Iowa established the Child Care Challenge Fund, initially utilizing a $1.1 million investment in state general funds, which has since been increased to $3 million. The competitive grant program in Iowa encourages businesses, nonprofits, and consortiums to expand and establish childcare facilities. These funds can be used for new construction, rehabilitation, or retrofitting of an existing structure. And finally, in 2019, the Illinois General Assembly and the Pritzker administration appropriated $100 million in state funds for the Illinois Early Childhood Construction Grant Program, which allows school districts and nonprofit childcare centers to apply for capital funding to improve facilities. State administrators can also incorporate flexible policies and career pathways that are responsive to workforce shortages, workforce turnover, and the lack of access to training, credentialing, and higher education in many areas. States can offer multiple career pathways as part of a workforce development strategy for childcare that takes rural challenges into account. A few examples from states that are already doing this work include Alabama, Kentucky, and Wisconsin. To learn more about the work these states have begun and how they're designing and implementing the workforce initiatives, I encourage you to visit BPC's report titled Apprenticeships, Building a Strong Childcare Workforce Pipeline. Developing and operating childcare should be a shared responsibility between parents, providers, businesses, philanthropy, and the public. Federal and state investments should be responsive to the distances traveled in rural areas and plan for those increased costs in their budgets and appropriations. Regional coordination throughout intermediaries helps mitigate the challenges by helping childcare program administrators, teachers, and staff access funding, technical assistance, and resources. Local businesses, nonprofits, and philanthropy can be important partners in investing in childcare initiatives, which brings me to the framework's recommendations. At a local, county, and municipal level, the framework recommends that legislators, individuals who are designing policy, review and revise local ordinances that operate as barriers to care, help develop regional early learning hubs, conduct a needs assessment, and identify additional resources at a municipal, county, or local level that could expand supply. At a state level, it's recommended that states support these regional hub models and consider increasing funding for administrative costs. Federally, the framework recommends policies be pursued that would expand access to capital, increase CCDBG, Child Care Development Block Grant, administrative cap, and remove barriers to home-based care. And finally, for the business, nonprofit, and philanthropic communities, the framework recommends partnering with local leaders and stakeholders to conduct a needs assessment and identify investment opportunities. And finally, before concluding, I want to thank our 40+ partners who have endorsed the Rural Child Care Framework document. Without your continued expertise and support, this work would not be as impactful or possible.
Okay, well, thank you, Brittany, for that presentation and for all of the work that you and others have done on the background on this. We want to move now into the panel discussion or the panel presentations, and we have three, I think, very impressive panelists with us today. The first one is Dr. Garrett Noland, who oversees Tyson Foods' corporate initiatives on childcare and immigration. He is leading a transformation of the way Tyson views social risk and how it impacts the company. Some of his proudest accomplishments are investments in childcare, hunger relief, and housing, which are necessary to support a viable manufacturing workforce. Dr. Garrett, and I guess I can call you Garrett, we welcome you to this. Yes. And would like to hear your thoughts on this. So thank you for joining us today.
Thank you. It is a real pleasure to be here. And thank you, Linda and Brittany, for all the context you laid out, because it does frame the challenge that companies have. And today I hope to offer you a perspective about how major manufacturing companies located in rural environments are dealing with this issue of childcare, how we think about it, how we are experimenting with it, and to offer you a framework for the way we think about the whole thing. First, let me start off by saying in July of this year, Tyson opened a brand new on-site childcare facility in Humboldt, Tennessee. That's West Tennessee. It's a community of about 8,000 people, and we built a major manufacturing plant there to employ about 1,500 people. As you can imagine, we build plants where there are animals and not necessarily where there are people. So we're often in very rural environments, and we're always looking for labor. Labor is a critical issue for us. And I'm really proud that Tyson stepped forward here and decided to invest in childcare, because it's the first on-site plant that we've done this at. And we've learned a lot about how to get through it. Now, childcare is both complex and complicated. It's complex because it's informed by lots of stakeholders. It's complicated because it's also shaped by cost, regulations, proximity, capacity, all of those other issues. And so when Tyson decided to step into this space of, should we do childcare at this particular plant, there was a very important question we had to answer for ourselves. What is the role our company wants to play in the childcare space? We're a major manufacturer. You eat our chicken, our beef, our pork products, right? We don't know anything about childcare. So we had to be really careful about how are we going to play in this space. And it came up with 4 questions you have to ask yourself. And these, I think, are appropriate for anybody involved in childcare, but particularly for a business. It's, what is the problem we really want to address here? What are the critical variables that are necessary for us to be successful? Who must we keep at the center of the solution that we're trying to build? And can we create a solution where the company, the community, and our team members, those are our employees, all benefit? Those 4 questions, and answering those 4 questions, took about 6 months at Tyson, because we really had to do some soul searching to find out what our role is. Now, Tyson is, you have to understand, is a major manufacturing company. We employ 125,000 people around the country. There's a 20% chance you eat our products if you buy pork or if you buy protein from the grocery store. So when we were asking ourselves, what is the problem we're really trying to address? The answer is labor. That is the problem our company is trying to solve for, is labor. And so everything we do is informed with that lens, with that perspective. We want more people to come work for us, and we want people to stay at work for us longer. We call that stabilizing our workforce. Now, the mean wage, manufacturing wage for a labor position in the state of Tennessee, which is where we have this childcare facility, is $36,000 a year. That's about roughly the same across the country for labor-based manufacturing jobs, not chip manufacturing. Tyson pays slightly higher to that. But on top of that challenge of wage rates and affordability issues is, in our sector, turnover in the meatpacking business is about 40%. So in other words, 40% of your workforce is going to turn over every year. That's huge. It's huge, and it's very disruptive, no matter what organization you live in. So we're looking at this labor problem of we need more people, and we want people to stay longer. What is the appropriate role of childcare in helping us solve that? And so for us, we had to answer 5 critical questions. And these are in order of priority for us. First is affordability. Can we build a solution so that people earning $36,000 a year can afford to use childcare? Really hard, but that was the most important issue we had to solve for. If we couldn't solve for that, we weren't going to get involved in it. The second most important issue is proximity. Because we're in a very rural environment, you can imagine when you're trying to employ 1,500 people, they come from an hour away to their job. They're coming from all over the place. We're drawing a lot of people into that. When we interviewed our team members, they told us they don't want to go more than 10 or 15 minutes out of their way. No more than 15, absolutely, out of their way to find a childcare facility. They just won't do it. And so that informed where we thought we needed to have the solutions existing. The third was availability. And availability is a function of time. It's a temporal issue. It's a function of time. So, if they can afford it and if it's near their work, is it actually open when a manufacturing plant is running? And manufacturing plants can run 3 shifts a day, 24 hours a day. We don't run bankers hours. We run 6 to 3, 3 to 1 a.m., and so on and so forth. The fourth variable is accessibility. So if they can afford it, if it's near work, and if it's even open when we are running our plants, do they have an open space? I can guarantee you that in the Humboldt case, there were none. It just did not exist. And the fifth variable that we needed to solve for was quality. Now, sometimes that strikes early education people a bit harshly, but we knew that if we could afford to build it and staff it properly and run it properly, we could solve the quality problem, but we couldn't flip it around and have it the other way around. So what did we do? We invested $5 million and built a brand new facility. It is managed and operated by KinderCare. They're professional operators of the facility. We cover about 120 people per shift, 120 children per shift, excuse me. The total fee is high for Humboldt, Tennessee. It's $12,000 a year is the annual tuition for the children getting there. This is a learning center. This is not lower cost, perhaps family-based or more church-based kind of babysitting services. This is truly curriculum-driven care, which was important for us. Tyson has, in order to solve the affordability issue, has stepped forward and said, we are going to guarantee at least $6,500 per child per year if you use that facility. And critically important, really critically important, I cannot overstate this enough, is the state of Tennessee. They stepped in and using their child care dollars, which they get from block grants from the federal state, to help offset the cost of tuition for children. So we've been operating for a few months now. We have 69 children in the center. The average cost to the parent is $1.60 an hour. That is the affordable solution that we were looking for. It's right next to the plant, so it's 2 minutes from their job. It's curriculum-based. It's guaranteed slots for them if they work at the plant. And I have to say it's going very well. I'd like to come back in a year and tell you about what we have learned regarding retention and attraction issues. So the company is using 3 metrics to evaluate the effectiveness. It's our ability to retain employees. We have to beat the retention rate of the manufacturing plant. It's our ability to attract people to come back to work. So, will people come back to work when they have childcare needs and they earn $36,000 a year? The answer is no. Will they come back if childcare is not an expense and they can get a full-time job with benefits? That's what we're banking on. And the third is absenteeism. We've had a dramatic drop in absenteeism due to childcare, and so far we've had no turnover for our employees there. So it's all in all, I'm very proud of it, and I think it's going very well. I look forward to your questions, and I hope the framework that we use to how we think about the problem is helpful for you.
Wow, that's pretty impressive, Garrett, and we'll take you up on coming back in a year. We'd love to look at those metrics and see what happens, because you're going to have your own mini study there for us.
Mm-hmm, mm-hmm.
Moving along to our next presenter, and Adam, who actually participated in our roundtable event here in DC. Adam Alsam is a volunteer president and co-founder of Appleseed Childhood Education, a 501c3 nonprofit corporation whose mission is to address the lack of quality early learning and childcare options in rural Jasper County, Indiana, and surrounding areas. I took this on, I think you've been working at this several years now, Adam, and tell us about your experiences in Indiana and the work that you've done.
So, Linda, thank you, and I echo Garrett's thoughts around BPC taking this issue up around what does it mean for rural childcare and what sort of things can it unlock from an economic development perspective. So, Appleseed Childhood Education was founded in 2020 by a group of volunteers here in Rensselaer, Indiana. Which is a town of about 6,000 people, halfway between Chicago and Indianapolis. It's on a major interstate. However, it's a heavy agriculture and light manufacturing community. And for the last 5 years, it's been a community that has had 0 licensed childcare seats available. So we live in a childcare desert. For the past 3 years, we've worked towards building a private-public partnership with local governments, local employers, local philanthropy, and a well-regarded childcare provider from a regional perspective to open Apple Tree Rensselaer, which is a 73-seat, high-quality, affordable, licensed childcare center in Rensselaer, Indiana. That childcare center is on the hospital campus of our regional healthcare provider, Franciscan Health. At the end of the day, we've opened the doors, and we continue to procure and build relationships in the community to build funding streams for operations. You know, a lot of what Garrett and Brittany has already said are things that we at Appleseed we've encountered daily, weekly, monthly for the past 3 years. You know, the biggest thing about rural childcare, whether it's in Rensselaer, Indiana, or anywhere else, is frankly to provide affordable and quality childcare. There is not a for-profit model that exists to provide that. You know, your choice is either families pay more or you don't have quality childcare. You know, and one of the central tenets of Appleseed is that, and through our project with that, to completion with Apple Tree, is that it had to be affordable for our population, right? It doesn't make any sense to go down the path of creating a child care center in a rural area if you're going to charge 12, like Garrett said, $14,000 a year in our case, which is the cost to actually operate Apple Tree. It doesn't make any sense because, like Garrett mentioned, in Humboldt and with Tyson employees, per capita incomes are not high enough here in Rensselaer, Indiana, to have families afford that. So we've gone on a different path and say, hey, frankly, we want to attract somebody like Tyson to our community from an economic development perspective, right? We have to be able to attract employers, right? Which really means we have to be able to attract and retain families to our place. And we view it from a rural viability and rural growth perspective. Our community, like I said, it's 6,000 people. In the last 10 years, we lost 15% of our population under the age of 18. We as a place have to create strategies and then execute those strategies in order to attract and retain young families to settle in Rensselaer, in a rural community, and then keep them here. And in 2023, I believe, and I think the partnerships that we've made and the success we've had here, it states that, and shows the fact that childcare in a rural community is essential infrastructure. It's the same as K-12 education. It's the same as sewer and water. It's the same as law enforcement and healthcare and broadband. And so, we have there's this incongruity between, state and federal policy and what the realities of what affordable and quality childcare looks like in throughout the Midwest and throughout the country in rural communities. And that is, it is not, from a state and federal policy perspective, it has not become a issue that is invested in any sort of meaningful way. However, at a local level, right, whether it's Rensselaer with Appleseed or a whole host of communities that I know throughout Indiana and throughout the Midwest are trying to figure out how do we create something, and how do we fund it, and how do we fund a building, how do we fund renovations, how do we fund ongoing operations, when at the end, when the whole and how do we find an operator to come to our area, where at the end of the day, none of this makes any money to begin with. And that is a hard answer to that's a hard question to answer. And what I think that it can be done. It takes a lot of work and it takes a lot of partnership at a local level, right? With Appleseed here, we've partnered, as I mentioned earlier, with a whole host of local partners that see the same thing that we do as Appleseed, that yes, the early childhood education is important on its own. However, it's even more important to attract and retain families here, which is attracting and retaining workforce, which is also the survival of our community for the next 30 years. right? So my kids have an opportunity, or at least have the choice to come back to the community that they grew up in, and everybody else too. And that's a powerful, I think that's a powerful story. And we've here in Rensselaer and with Appleseed, we have been unbelievably lucky with the partnerships. Not lucky, we've been unbelievably thankful and humbled by the partnerships that we've made in order to create affordable, quality childcare a reality in Rensselaer.
Well, thank you, Adam. That's so important. And I know just having you, understand the economics of this and saying it so plainly is helpful to everyone. And we'll come back to that in a minute. I want to introduce our last panelist. Heidi has been with us before, so welcome back, Heidi. Heidi Hagel-Braid is with the First Children's Finance in Minnesota. She's been a panelist for us in the past. I think, Heidi, I'm going to turn it over to you and have you tell the audience what you do at First Children's Finance and why you started specifically the rural project that you did. And Heidi was the person behind that, 10 years ago, Heidi? It's been going now, so congratulations on that.
Well, thank you, Linda. It is really a pleasure to be back with you. I'll take your last question first. You can take the girl off the farm, but you can't take the farm out of the girl. When I joined First Children's Finance, which is focused on building the sustainability of childcare businesses, I brought with that experience my background as a person living in a rural community, growing up in a rural community and experiencing childcare as a user, and realized that we need to expand our projects and programs to really think about rural differently. Childcare in rural communities is different in scope and the challenges are different. And so I led an effort to create the Rural Childcare Innovation Program here at First Children's Finance. It's been operating continuously for the past 10 years. And I'm grateful to be able to tell you a little bit about it. I'm going to refer to it as RCCIP because that is faster to say than Rural Childcare Innovation Program. So when you hear that acronym, that's really talking about our efforts in rural communities. The basis of our work is really thinking about childcare as a rural economic development strategy. And it uses a community engagement process that's designed to identify right-sized solutions. And that's the critical piece there, is that a giant childcare center without the support of a employer may not be able to survive. And so really thinking about the size and scope and scale of the problem in a rural community and designing solutions that are custom to that community are important. Our overall effort is to increase the supply of high quality, affordable childcare in rural communities. And we do that by mobilizing community members and empowering the creation of community-based solutions. And when we do that, rural communities are able to preserve existing slots that already are operating in their communities and to add the new childcare slots that they need. We really come at this from a capacity building perspective, knowing that rural communities are strong, resilient, creative, and we're just there as sort of a guide to help them understand childcare and to apply what we know about the technical aspects of childcare to help them design those solutions. Most of all, we want to build sustainable solutions that are going to be there to last. And to do that, we make sure that childcare is fully understood, that all the members of the community have a precision understanding of the supply and demand and the factors that are impacting childcare businesses, whether they are closing, whether they are struggling, or whether they are not able to get up and off the ground. That community needs to understand those impacts. We really try very hard to leverage community expertise and to spur innovation, creating solutions that preserve and create new childcare slots. This project takes about 18 to 24 months for a community to complete. It includes events and opportunities that provide education between the links of childcare to economic development. And the important piece here to note is that rural communities, their biggest export is the children and families who live there. And when we think about the strength of rural communities, they're really trying to retain folks, to attract people to come and live and work in those communities. And childcare absolutely is the third leg of the stool. You have to have a place to live, you have to have a job, and you have to have childcare. Particularly in the upper Midwest, where I live, we have a high concentration of women in the workforce. And so making sure that the labor force participation rate remains high, childcare is one of the strategies that rural communities can use to build that viable, strong regional economy. So we help to establish a local core team that drives change by identifying resources to increase the supply of high quality care. And we walk communities through a thorough understanding and analysis of their gaps and the needs, and help them to think about what kinds of solutions are available. Each community develops a multi-jurisdictional community solution action plan that includes innovative solutions. And that plan guides long-term decision-making in communities as new opportunities and resources are identified. And then at the same time, we work to support existing childcare businesses, because there is sometimes some worry about the overall supply dipping because they feel threatened or worried about some of the things that are changing. And we really work to make sure that any existing providers who are doing this hard work right now continue to do so, and also benefit from the investments that are being made in the community at large. Our impact really is about creating partnerships with local employers to engage supporting childcare businesses. And the great news is you don't have to be as big as Tyson Foods. You can be as little as the Main Street hardware store. There are all kinds of different solutions that are available here, including contracting for slots, creating employer-sponsored childcare, financial or in-kind support. We work with economic development authorities to prioritize childcare in their efforts, whether that's providing forgivable loans for starting up new childcare businesses, and inclusion of childcare in business recruitment strategies. We engage with public systems, helping them to think about publicly owned facilities, local ballot initiatives, bonding for childcare facilities, or repurposing community assets to be used for childcare. And then overall, increasing the awareness and importance of childcare. We found that in our RCCIP communities, when the early days of the pandemic were devastating childcare, we saw those communities rally around childcare businesses because they knew the importance of doing so and were able to preserve that supply. And then overall, we're measuring the impact of new slots, preservation of existing slots, creation of new jobs, and then the expansion and creation of facilities.
Okay, well, that was great. And we're getting a lot of questions coming in. I want to remind the audience to submit your questions. And even if we don't get to them, because I'm sure we won't, the numbers that we have here, we will get back to you with answers. I think I want to start with a question that came in that I think is important for us to think about. Michael Howard asked the question, all employers understand the impact of childcare. Why do so few do anything about it? Are they all just hoping the government will implement universal pre-K so they won't have to pay? What do you think is behind our lack of ability to get national traction on this? Because we find the same thing to be true in our work at BPC, that businesses do understand this. So what's the barrier? Why are we not getting more traction at the, across the country on it? Anybody have an answer to that? Would like to take that?
I can offer a perspective on that. So business works in the harsh reality of profit and loss, right? And so our ability to find new labor competes against the cost of the ability to provide childcare. In in labor-based positions, the cost to replace that employee is Harvard Business Review did a general study. It's about 25% of your wages is the cost to replace you, right? So if you use that as a general rule of thumb, and you're paying people $36,000 a year, like is a labor-based manufacturing job, you begin to see that that's the cap. Okay, so if I can do childcare and it's cheaper than that, then that's a good thing. But the element that makes it more complicated is childcare, like other social issues, are very complex for businesses. We're not set up to solve social problems, and we don't want to solve social problems. We want to run our business. We want to make more chicken and steak and all of that good stuff. If there was one thing that I would recommend that would help businesses, help everybody actually, would be for the federal government to change the reimbursement schedule that they use to subsidize the cost of tuition. So for example, states can either choose the adjusted median income or the federal poverty level, right, as their basis. In Tennessee, they choose 85% of the adjusted median income is who is eligible to receive a subsidy from the federal government. That roughly comes out to be, say something like $35,000–$40,000 a year in wages.
Mm-hmm.
For the manufacturing sector, that largely takes all of our employees off the table, right? That they're not eligible because we tend to pay a little higher than the median income of a community. So my short answer to all of this is, and I'm glad that this is a policy forum, funding is policy, policy is funding, right, with the federal government. You can solve much of this childcare issue if we approach this as a social good and the federal government funded it like they did for schooling. And that means, you want to have an economic development strategy, you want people to work, pay for childcare. If you want to have an education policy and you want people to prepare for school, pay for childcare. So I'm sorry, I deviated a little bit there, but I wanted you to be sensitive to it's a replacement cost for us. And unless we get, money's only going to come from the parent, the employer, the government, or philanthropy. Those are the only sources of money for childcare that are out there. The federal government says parents should pay 7% of their family income. Right? Health and Human Services is 7%. You just do the math from that, and you can see what they can afford and can't afford. I'll stop there.
Okay. Anybody else want to take that one? Because I've got plenty more. So, okay.
Very quickly on that as a follow-up, Linda. Like, frankly, there is no child care infrastructure in the United States. It is disjointed in every different community, whether it's a rural community, an urban community, neighborhoods within urban communities, and that disjointedness causes incongruities in access and affordability and all the other things. From an employer perspective, right, the biggest thing you can do is go find what's going on in your own community and then go support it. That's all. Until policy changes, it's a local issue that has to be solved locally.
Okay. Thank you for that, because that's true. I mean, at this level, this question, I think, layers on the one I just asked. Got a couple questions in here about facilities and the challenges, because there are no facilities in many of these towns, to accommodate childcare. And so I think, what suggestions do you have about taking on this challenge of the lack of facility or even space that could be renovated? And I know, Adam, you did it. I mean, so do you have any thoughts on that? What can other communities do here?
It's we were maybe a slightly more we're slightly advantageous. We had a great relationship with our regional healthcare provider, which had a facility that they did not need anymore. And they have a mission-based, they are a mission-based organization, and there was a lot of alignment between the two. Deferred maintenance and depreciation of buildings and assets in rural areas is a massive problem. And I think what communities can do is they have to get very, very creative, right? It's saying that church that closed that we're all sad about, who owns that, right? Or is there a healthcare building, right? Or is there an old doctor's office that we can start small? Is it family in-home providers, right? Do we go that route? And it's trying to, like what Heidi said, earlier, it's about how do you scale for your community, but it's taking whatever assets that are in a community and trying to leverage them just as much as you can around this, because it isn't, the facility is the number one, it is the first problem to solve.
I'm going to layer onto this one because every community needs a Heidi. Because to your point, I think I've been in a number of communities lately in Montana, Wyoming, or South Dakota, North Dakota, that part of the country, where they may even have the space, but they don't know what to do next. And I think we lack the technical assistance that we can give to communities. Adam, you went out and learned it because you had to. It sounds like Garrett, you did the same thing. You're learning in an area of early childhood. We need a Heidi everywhere. And Heidi, would you comment on this? How can we help more of these communities who want to do it? And where do they go next?
Yeah, I think it's a great question. And I always encourage rural communities to think about spaces don't think just about family childcare and don't just think about a childcare center. Look at what spaces you have and imagine where childcare can happen. So think about publicly owned buildings. Think about schools that are underutilized or under-enrolled. Think about places that are untraditional for childcare, but might fit the bill with some renovations. I also want to point out maybe a policy solution. And I happen to live in Minnesota where this is a thing, where there is a specific bonding program just for communities to bond out childcare projects, because there aren't any economies of scale doing it on your own. And it puts the entrepreneur at risk who is laying out the capital. So one of the ways to solve for that are to create bonding programs or financial incentives where cities, counties, municipalities can build and maintain those facilities as a community asset and utilize them for childcare. And with the right design and right innovations and licensing, you can think about how those buildings become hubs for so much more. But I've seen a wing of a school turn into an early education hub where Head Start, childcare, occupational and physical therapy, and screening are all housed in a one-stop shop for early education in a rural community. So really thinking about the common or public spaces available, how you can renovate those and think about them for childcare. Don't forget about Main Street. You have an empty Main Street in a lot of rural communities. How can you leverage that for childcare? I could talk about this all day, but I think there's lots of possibilities.
Linda, could I add to that? Because
Yes.
from a company's perspective, the cost of capital, the cost to build these facilities is the most painful of all the costs, right? Is because we don't want to take our money out of a productive use to generate revenue to something that doesn't generate revenue. So it's much easier for us to take money and pay a team member a benefit every year as part of their benefits. So if there was one place where we could all kind of get together and advocate for, it would be greater government involvement or nonprofit involvement in building the physical infrastructure. If you knock down that problem, in many of my communities, I can bring lots of people to it, but we just can't get over the cost of the capital.
Right. And that's something that we've been working on now for several years at BPC, and we've actually had some success at getting some legislation introduced, bipartisan, in the House and the Senate to support infrastructure, because that's the truth. And one of the questions that came in, and I think it layers on to what we're talking about. I think in the early childhood field, we're also stuck on this idea that we need to have a certain number of kids in order to do something. In other words, economies of scale. And I keep pushing back on that, because a lot of people think you have to have 100 children to make a childcare viable. And to a certain extent that could be true, but I can beat you all. I'm from a small town in Montana, 2,500 people, okay? And we did childcare. So I think that people, what they misunderstand is that it costs more, not less. It's not impossible, But then you have to figure out the share of who's going to do what. And I just want to put that out there on the table, because I almost like a bull in a china closet when I hear that. We can't do it because there's not enough kids. I think we have to. I want to go back to the beginning, and we had a couple of questions about in terms of your plant in Tyson. How much does the state put into that in terms of percentage or anything else? Or is it just through the subsidies, or is there a percentage that they've had added in there?
Yeah, thank you. So the particular, you could think of it better as terms of what was the government's contribution and Tyson's contribution to building this $5 million facility. The local economic development agency donated the land that we built on. The state did not provide any capital money, although they did give us a grant of $150,000 to help fill with equipment and so on. The cost of constructing and everything largely fell onto Tyson. I would say 97% of it was on Tyson. And I mentioned earlier that would be painful for us to have to do again. Mm-hmm. We would much prefer collaborations with the community or shared investments, where 3 or 4 companies get together and build a facility or attach it to a school or renovate a church and so on and so forth.
Mm-hmm. Another question that's come up from a couple of people is, what is and I think both Adam, you and Garrett, the question is coming up about the actual pay of the workforce within childcare. And, we know we have a childcare workforce that is way undervalued and underpaid. And so how are you addressing that in both of your programs or your models? Adam, maybe you first.
So at Appletree, Rensselaer, it's a tough issue, right? And as a starting point, we acknowledge as an organization that early ed workforce is extremely underpaid, period, full stop. We pay somewhere between $13 to $17 an hour, but we also offer a full benefit package at the moment. And that's our first initiative. And frankly, that's driven by our operating partner, Right Steps Child Development Centers. They do that. They operate 7 centers in our geographical area. They do that at all their centers. We are completely aligned with our operator on that. And we also know that that's not enough. And we know that over time, and as we as an organization are able to continue to fund this affordable quality childcare initiative here in Rensselaer, that has to go up, which means Appleseed has to go and raise more money, because it is not a tenuous situation. It's how do you ask somebody to go get educated in early ed from either a CDA perspective or frankly an associate's or a bachelor's if you're going to get paid vastly worse at the end of it than an elementary school teacher. And it's not good, but we need to do better. And it's at the end of the day, it is just saying we have to pay people more, which in order to make it more affordable, it means that we as an organization will go raise more money.
Because we're slightly unique in this scenario where we built a solution for ourselves. We built a child care center for our own workers. We built in sustainable wages up front. And so we pay $17, $18 an hour starting wages for the facility plus benefits. And because it didn't make sense to build a facility when you're underpaying staffs and they would turn over and then you don't have the facility for the child care. So we found our sweet spot at about 17 to 18 in this rural community as sustainable.
Mm-hmm. Wow, that's great. Okay, you guys, well, I think we're running out of time and there are many questions in the chat. So we will be following up with the people who were on the list for this webinar with some answers for people on it. I think everybody, including myself, learned a lot from this panel, and I can't tell you how much we appreciate you taking the time to do that with us. And in closing, I guess I'd like to thank all of the people who worked with us on the roundtable, who participated in that, the people who commented on the framework. We hope you go take a look at it. We think there's some real solid recommendations in there. Thank Save the Children and Mary Nugent for her support on this and Save support on it. And then for everyone around the country who is interested and wants to do something about this, I think we have an opportunity. There is interest, and it is bipartisan on Capitol Hill for solutions to this problem. So hopefully we will glean something from this webinar that can help us promote better policies up on the Hill. So thank you to everyone who joined us, and to the panelists, in particular, Adam, Garrett, and Heidi. Thank you very much. Appreciate it. So we're done.
Thank you.